Probably the reason that they didn't have a vet come to your school was because they're real busy at work and it's hard to get away and go do fun stuff like that. But some of the things that we do is, well, I'll tell you just kind of basically what I do in a normal day, okay?
Okay.
We get here real early. I get here like at 6:45 in the morning. And then if we have animals in the hospital, we check our animals in the hospital and you know, examine them and give them medicine that they need. And then we start seeing patients up front. When you came in the office, there are some people in the waiting room, right?
Yeah. And like when I saw this cute little dog. She's nibbling on my finger, but it didn't really hurt.
Yeah. So then people come in there and bring in their pets, like a lot of puppies if they need their vaccinations or just things to keep them healthy, or if their pet's been sick, they'll bring them in to see us. So we treat those patients during the day. And then during the week, we have, sometimes we do surgeries. Some of the common surgeries we do are what's called a spay, which is to make a female dog or cat so she can't have babies. Did you know that they have to put a lot of dogs and cats to sleep every day at the Humane Society? And they do that because a lot of people they're not responsible about their pets, and they let them breed and have more babies than they know what to do with. And then these animals just get loose, and so there's nobody to take care of them. It's really sad. So we try to get people to spay and neuter their pets so that that doesn't happen. So we do surgeries and we do dentistries, just like have you ever been to the dentist?
No.
Okay, well, someday soon you'll go to the dentist and get your teeth cleaned, and you do that pretty often.
Because I haven't met a dentist on Career Day.
Yeah, and we do that for dogs and cats.
And then I'm in a florist.
Yeah. So we do those kinds of things, and then at the end of the day, we treat all of our patients in the hospital again, and then we get done. We have to write on all of our records, so by the time we leave here, we leave about 7 o'clock at night, so we're here pretty much all day. We do eat lunch, though.
Okay.
This says, do you have a scale? Did you see a scale in the waiting room?
I saw like this pad and then a line.
That's our scale, and you can stand on there and it'll tell you how much you weigh too. So we weigh all the animals before they come in. Plus we have a little bitty scale. Say we have like a little ferret or a little bunny or something, we have a little small scale that we can weigh them on in grams.
Yeah, like those little puppies are for the little scale.
Mm-hmm. If they're real tiny. What's your next question on the next page? Is there a place for the puppies to wait? Well, you saw our waiting room up front. Yeah, we have a place where they wait.
Like, if the puppies need some exercise, is there some place for them to wait for some exercise?
Well, we have like the side yard over here. If somebody's waiting and they can take them out there on a leash, and the puppies can chase the squirrels that are out there, and so they can wait outside too.
Oh, okay.
You have very good handwriting.
Thank you.
Let's see, don't forget this page here. Where do you put the pets? We have hospital cages in the back, and the pets that are sick or ones that we're treating, we have a place in the front where we can keep an eye on them. Or say the ones that we're doing surgery on, we keep them there before we do surgery, and then when they're recovering, they're right there. And then we have some rooms in the back where we can keep them too if they're boarding or just staying.
Okay.
Where do you put your doctor tools? Well, they're all over the place, really. Like, there's some in here. You know what this is called?
A stethoscope.
All right. Have you ever used one?
Yes, I have one.
You do? Okay. So.
Like, I have this blue toy one, and I turned speaking in it. It was supposed to be a toy, but
it's really, a good one?
Yeah, it works like a real one.
So we have that, and we have one of these to look in the eyes and the ears. See that bright light? You can look in their ears with this. Just like when you go to the doctor, right? It's the same thing. This little thing to look in their eyes with.
I've been to the doctor before, so I pretty much know their tools.
Yeah, it's the same kind of tools.
Yeah.
And then we have lots of tools in the back too. And there we got the thermometers in there and just some medicines that we use all the time.
Okay. What's in this one?
That's just paper towels to clean because we have to clean after we clean. What's in there? Gloves, good smelling spray, bandages. What's in the next one there? Watch your fingers, make sure they don't get squeezed. Bags to put the medicine in before they go home.
Yeah. Whoa.
Needles and syringes.
What are these?
That's a leash.
Oh. In case someone needs a leash.
In case their dog's not on a leash. Okay, what else do you have here? Okay, we saw how to use them, right? We used some of those. So you answered that question already. Let's see, where are you? How did you get your doctor tools? Well, we usually just have to order them. We order them from a company that makes them.
Oh. And is that from the inside of the dog?
That's what the insides of a dog look like with worms, and those are the different kind of worms they get. Pretty gross, huh?
Ew. Gross.
That's why we put them on heartworm medicine so they don't get those worms.
Yeah.
What else do you have? Let's see.
This is my favorite color heart.
That's all right. How
And
did you get your job? Well, you have to go to school a really long time to be a vet.
Oh.
So you go to high school, and you graduate, then you go to college, and then you go like 4 years to college, and then after college you have to get into vet school, and you go 4 more years to vet school, and then you can be a vet, go out and practice. And you know, there's some vets that even go to school longer than that. Like doctors do. Sometimes they'll go and do extra training in certain areas. Say they want to be a heart doctor, or they want to be an eye doctor. They can go to school for a few more years and just do that. There's some vets that just do like heart medicine on dogs and cats.
Oh,
And some that just specialize in different areas.
Did you know that I used to live up in McAllen, and up in McAllen there are 2 dogs, Jack and Avery. Black and white is Avery, and the white one is Jack. When we got Davy and Christy moving in with Jack and Avery, we started to make Jack and Avery have been going to the restroom a lot outside and in our backyard, and then our garden just became a little like restroom for the dogs.
Just became a dog yard. That's what my backyard is too. It's just a big restroom for the dogs.
Yeah, and now I have to watch out for dogs.
It's like a minefield.
Yeah. And now I need to watch out for the slide and the swings, because that's what my swing set is.
I'm going to send you some papers because I have some information that tells you some answers about like different things veterinarians do and things you can do when you get a little bit older to kind of prepare for it. So let me go in the back and get those things and I'll bring them for you. Okay? Do you have any other questions?
No, these are the last
Those are the ones. Okay, let me go bring those for you. Okay?
Sure.
I'll be right back.
Right? It looks like clear with no worms like this?
It does have worms. You see the little things?
Yeah.
Those are called hookworms. That's what the thing says.
Hookworm?
Hookworms, yeah. You see the red words? That's the name of the worm. Can you?
Hookworm.
Yeah. Can you read that bottom one?
This is whipworm?
Whipworm, that's right.
Yeah, whipworm.
And can you read the one above that one?
Roundworm.
Uh-huh, and the one above that one?
Heartworm.
Perfect.
So we don't want any of those to get in our dog
Right.
or cat.
Right.
So all we need to do is keep our dogs and cats safe from me. So it said, protect your dog from these dangerous predators.
Parasites.
Parasites.
Good reading.
Okay, thank you. But why are they dangerous?
Well, okay, read the very top. The big dark black words on the right.
Dangerous
Heartworm disease can be fatal if left untreated. That means they could die.
Oh my goodness. That sounds so scary.
Mm-hmm.
Oh, those are so cute. Behind you. Behind you. Those are so cute. So cute. Look at this. How cute.
Very cute.
I love that guy. Look at this one. It's a bit like me, right? Only with blonde hair.
Yeah.
I don't have blonde hair. Does this dog look a bit scary?
Nope, not at all. She kind of looks like Reese.
Oh. Oh, look at the inside. Whoops. Maybe it's sort of good too. Oh no, it comes like that. Look it.
See, heartworms. And there's fleas, and there's roundworms, and hookworms, and whipworms. So these have the 4 worms that you studied from the post-trip there, plus fleas.
Oh. See this?
What does that one say?
I don't know. What is the whole book about nutrition?
Nope, doctor's back.
If you want to take any of those brochures with you, you can. And
I want to look through this one to give it to Danny and Chrissy
okay, take it with you.
so they know.
It's got lots of those rody worm pictures.
So they know not to let their dog get eaten.
Right. Here you go. There's a lot of information in there about becoming a vet and things to do. But when you get old enough to get into high school, think about going to Med High in Mercedes because that would be a really good way to prepare.
Okay.
And
I was wondering, can I look at some pets in the back?
yeah, I'll take you. I'll show you around what we have in the back.
Okay.